Android, also known as methyltestosterone, is used in men who do not produce enough testosterone. Testosterone is essential for normal functions such as the growth and development of genitals, muscles, and bones, as well as normal sexual development in boys. Methyltestosterone is similar to the natural testosterone produced by the body and belongs to a class of drugs known as androgens. It works by affecting many body systems to help the body develop and function normally. This medication may also be used in certain adolescent boys to cause puberty in those with delayed puberty. It may also be used to treat certain types of breast cancer in women. The daily dosage and best time to take this medication should be determined by a healthcare professional. When taking Android, it's important to follow your doctor's instructions. You may be directed to take it 1 to 4 times a day, with or without food. Your dosage will depend on your medical condition and response to treatment. To get the most benefit from Android, it's important to take it regularly at the same times each day. Misusing or abusing testosterone products can lead to serious side effects, such as heart disease, liver disease, and mental/mood problems. It's important not to increase your dose or use the drug more often or for longer than prescribed. If you experience any withdrawal symptoms or if your condition does not improve, be sure to notify your doctor. Some common side effects of Android include nausea, vomiting, headache, skin color changes, and changes in sexual interest. If any of these effects persist or worsen, notify your doctor or pharmacist. Remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience serious side effects such as mental or mood changes, signs of liver disease, swelling, unusual tiredness, or irregular heartbeat. Seek medical help immediately if you experience very serious side effects like shortness of breath, chest pain, sudden dizziness, or vision changes. For males, report any serious side effects such as trouble urinating, breast swelling, or prolonged erections. For females, report any serious side effects such as deepening of the voice, unusual hair growth, or irregular menstrual periods. A serious allergic reaction to this drug is rare, but seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Android, make sure to inform your healthcare provider about any allergies you may have, as well as your medical history, especially if you have conditions such as cancer, blood clots, heart disease, stroke, liver or kidney problems, high cholesterol, high blood pressure, enlarged prostate, breathing problems, or diabetes. If you have diabetes, Android may lower your blood sugar, so it's important to monitor your blood sugar regularly and discuss the results with your doctor. It's also important to inform your doctor if you experience symptoms of low blood sugar. Before undergoing any surgery, let your doctor know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults and children may be more sensitive to the side effects of Android, and it may affect bone growth in children, so it's important to monitor your child's height periodically. Additionally, Android can affect fertility in males, and should not be used during pregnancy as it may harm the unborn baby. It is also not recommended to breastfeed while using this medication. Be sure to discuss reliable forms of birth control with your doctor if you are using Android. Interactions with other drugs can impact how Android works in your body and may increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use, and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor. Some products that may interact with Android include blood thinners such as warfarin. Additionally, Android may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are taking Android. If someone has taken too much Android and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help by calling 911. Alternatively, you can also contact a poison control center for assistance. In the US, you can reach your local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. It is important not to share Android with others as it is against the law. While taking this medication, it is important to undergo lab and/or medical tests such as blood testosterone levels, red blood cell counts, liver function, blood cholesterol levels, and PSA test. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Android, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose as scheduled. Don't take double the dose to make up for the missed one. It's important to store Android at room temperature, away from light and moisture. Make sure to keep it out of the reach of children and pets, and do not store it in the bathroom. When it comes to getting rid of any leftover or expired Android, it's best to consult your pharmacist or local waste disposal company to do so properly. Remember not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.